main problem with chronic stress is it's usually pain-free. So you don't even know that this tooth here might cause you a frozen shoulder, sleeping issues, anxiety, mental health problems, even cancer, neurological disease, you name it. SIBO, acne, skin eczema, gut health issues, joint issues, even inflammation in your brain. Never lose your healthy tooth. But if you had a root canal or an inflammation and your tooth is gone, I get it, we need to repair.
I'm Dr. Esra, and I've been living a sober life for the past 18 years. My battle with addiction drove me to seek new methods, devices, and supplements to improve my physical and mental performance, enhance my quality of life, and ultimately live healthier for longer. From my experiences in addiction recovery, biohacking, and longevity to the latest global developments, from groundbreaking entrepreneurs to expert academics, the conversations I've had over the years are now featured weekly on Soberhead Podcast. Welcome to Soberhead Podcast. This week, our guest is joining us from Germany. In this insightful episode, we sit down with pioneering biological dentist Dr. Dominik Nischwitz, who reveals how oral health can be the missing link in your wellness journey. Chronic fatigue, stubborn sleep problems, or nagging aches may just not be in your head. Dr. Dome shows us why the mouth is truly the gateway to the body. From metal fillings and root canals to hidden jaw infections, he explains how cleaning up your mouth can supercharge your overall health. If you're ready to discover the fascinating connection between your oral microbiome and full body vitality, then stay tuned, because this episode will change the way you think about the dental care forever. Here's something that is fascinating. A huge amount of people who watch this channel frequently are not subscribed. So I want to ask you a quick favor. When you subscribe, it helps us to make the show better, access to the world-leading experts, and ultimately bring you more value. All that I ask is for you to hit the subscribe button, and in return, I promise we will make Ayık Kafa better every day. My dear friend Dome, Dr. Dominik Nischwitz. Welcome to Soberhead Podcast from Germany this time. And I'm so excited to do this episode with you, and I'm really hoping that we can influence dentists in Turkey. The reason is that, let me tell you about when I first heard something, what you're doing, and then how it evolved. I did a podcast with Sandra Garcia, and you said that you know her. Spanish dentist in England. She resides in English.
Yes.
Yeah. And she told me back then, it was like so weird to me that you don't do any root canal. Instead, you choose to pull the tooth out and put an implant. And I'm like, wow, that's intense. I couldn't wrap my mind around. Then going around these conferences, I think it was in Finland. After Finland, my dear friend Sean Wells came to you. And until then, it was somewhere back in my mind, but I wasn't taking it very seriously. And, I started talking to Sean, and he says I'm here, he's pulling my teeth out and, cleaning the metals and whatnot. I'm like, oh my God. And I started thinking of myself, and I started looking to the mirror where do I have a metal? How many root canals I have. And then I started, knowing that, I required to do a podcast with you, and to prep myself, I listened multiple podcasts that you appeared. One podcast that really got me thinking is the one with Gary Brecka, because he was sharing his own experience, how one root canal was related to so many health issues. And I'm like, oh my God, this is real. So welcome. How shall we start? You're a biological dentist, and you're one of the first ones, I guess, in the world.
So, first of all, thank you for having me, Esra. I like that. So biological dentistry is a term that is not trademarked. Everyone can call themselves a biological dentist. So I'm one of the first ceramic implant specialists. That's probably what you're referring to.
Okay.
And the biological dentistry way that I'm teaching, or we are teaching, is called Bio Dentistry 3.0. And this is I'm working on getting this towards the gold standard in dentistry or biological dentistry, because it's not focused only on the technical side of things, which biological dentistry or holistic dentistry mainly is, but the 3.0 is an overlap of the high-tech skills with integrative medicine and health optimization, biohacking, obviously where we overlap, because we can help a patient overall by starting in the mouth. So it's a complete change in our profession from the technician to the physician, because our goal should be to help patients overall health, but at the same time, obviously have excellence in the technical skills. So it's quite good that I'm one of the first ceramic implant specialists, because this is kind of like my badge of honor in the conventional dentistry world, in the surgery world, because not too many dentists do a ceramic implant anyways. And I have a lot of clinical data, so therefore the conventional dentist would also listen to me because of the technical skills we have.
Let's first start then explaining to our audience, because I just learned it from you, to be honest with you, that, dentists are kind of doctors, but they're not considered as doctors in a weird way.
Yeah, the problem is, in America, the word is dentist. So dentist it comes from the barber surgeon, and most patients still think of the dentist as like someone who's very rough, rips out teeth and just basically repairs their teeth, fixes smiles and bites. That is correct. In Germany, for example, dentist is called a tooth doctor. And also in America, all over the world, we are actually medical doctors with a special focus. So kind of like a cardiologist who is a specialist for the heart, we are a tooth specialist or oral health specialist.
But in a way, how you explained is that, they're so focused into the teeth that therefore they do not look into the connection with the rest of the body.
That is a little bit of a problem when it comes to the way how the dentistry university is designed, because obviously we are medical doctors. We're studying everything: science, physics, chemistry, biochemistry, anatomy, whatever. The regular medical doctor does too. But we also learn a lot about the technical side of things, meaning how to repair a tooth. So we go way deeper into materials and science there, and basically made a study out of something technical. That is the problem, that we, as a profession, mainly focus on, really, like you said it, repairing a tooth for biting, fixing teeth and pain, but maybe also from an aesthetic point of view, giving you a nice smile, but not extended to the overall body. Even though obviously we have the training for it, it's just no connection. But that is a problem in overall medical world, that we have so much specialties. So usually the orthopedic surgeon would never talk to a dentist, or a cardiologist usually doesn't talk to, you know what I mean, like the hormone specialist. So this is the same problem with dentistry. So what I'm trying to do is changing the whole profession and understanding, okay, we still need our technical skills to repair tooth. However, we have to understand that these teeth are an extension of your brain, part of your body. The mouth is kind of like the entrance to your whole body, and that whatever we do in there is affecting the whole body and maybe making it even sick, or we can actually make it healthier again if we focus on what has been done previously regarding dental repair. Because as a technician, to repair a tooth, we use all sorts of material. We use metals. We leave dead root canal treated teeth in your mouth. We use implants that are made out of titanium and various other things that are generally not part of the human body. They were ideal for a machine, but we're not a machine. So it's just the next level, and making it more complete, helping patients getting overall healthy by starting in the mouth.
So kind of fits very well into the functional medicine approach in a way, because, lately we heard, not lately, but the last couple of years, one of the very important sayings out there, especially with Dr. Bredesen, who is an Alzheimer's specialist, saying that from the mouth, like everything goes to the brain. And I started thinking, oh yeah, actually, in the dentist, you don't have that type of super hygienic places. They pull the tooth, they just drill it, they do whatever, all kind of things, but you're not in a surgery room. In a way, you're kind of like in and out people. Start making sense.
Exactly. So I think what the main thing is, that everybody actually also in the world of functional medicine or health overall is finally, I think it started last year, finally most of the health influencers are talking about oral health and including oral health into overall health. So for example, Huberman had an episode about it. I heard one on the Diary of a CEO, and as well as Peter Attia, a lot of functional medicine doctors starting to teach. Even Brian Johnson, the blueprint guy, who is having a strong oral health routine. However, it's right now it's still very surface level because it's only about how to take care of your oral microbiome, what is the right cleaning structure, which toothpaste to use, do we floss, do we use coconut poly, all these things. But what they're still missing out, and that's also what the dentist usually is missing out, is there anything lurking in your mouth from previous dental work that is affecting your whole nervous and immune system on a daily basis? And that's why I ask these questions usually, like already you asked yourself, is there any metal in my mouth? Do I have a root canal? And have my wisdom teeth been pulled? And for example, do you still have a metal in your mouth? Or root canal?
I think I have root canal. I have a metal in my mouth, and my wisdom teeth are pulled, the bottom ones. So okay. I'm a perfect candidate.
Yeah, so usually if you're the candidate, let's just go this way. So you're already doing everything when it comes to health optimization, right? That's why you're on that path. So, but I'm quite sure there's still a few nagging issues in your body where you think, there's room for improvement. And the only info I want to bring out is, if you already try everything to get superhuman, but you're still not, then maybe your deep sleep is lagging.
I was just going to say that because the sleep is my thing. You know, we're doing every single thing. And since I started studying for you, I'm like, I'm really wondering if that's connected, my sleep.
Exactly. And this is when oral health, and especially these, it's called oral interference triggers that are in your mouth that are there because of dental repair. They can affect your whole nervous system, your autonomic nervous system, your sympathetic nervous system, your parasympathetic, your hormones. It's cytokines involved. It's kind of like swallowing a pill every day that it works systemically, right? So whatever we have on your teeth or done in your teeth will affect your body because these teeth are connected with that trigeminal nerve. It's one of the 12 cranial nerves. So everything we do in here gets transferred straight back into your brain and then obviously works systemically. And also every tooth is directly connected with specific organs in the body. That is Chinese medicine, but still, it's the nervous system. So you have to understand it. So that's the approach. If you come to me and you're like, you want to optimize overall health, then we look at your teeth different than a normal conventional dentist because you can bite, right?
Yeah.
You have no pain, right?
No.
Your teeth look nice, right?
Yeah.
However, if I now do a cone beam scan, 3-dimensional X-ray, or a panoramic, I see, Esra has a couple of root canals, there are maybe some metals, and she told me that the wisdom teeth are pulled. So I know there's a lot of room for health optimization if we address this.
Let's then go one by one because these three things are very important for you. So let's start with the root canal. So many people has it. What's wrong? What's wrong about it?
First of all, this is a little bit of a black and white thing, and it's hard to get across on social media if you just scan through various different things. It's always root canals are bad, they kill you. And on the other side, root canals are very perfect, you can bite them. And it's not correct. Let's say when it's about average health and just having a bite, a root canal is probably fine. You have it too. It's all okay, right? But if our focus shifts towards the extremes, so we want to have optimal health, which is a 10 out of 10, or we're super unhealthy, chronically sick, we also need out of 10 out of 10 to get healthy. Let's say cancer, neurological problems, immunological issues, autoimmune disease on this side. So high performance entrepreneurs like yourself or this extreme, they need a 10 out of 10. And in this realm, a root canal can become a chronic health trigger because what has been a vital organ, it was alive at one point, is now a dead organ. It's a dead tooth because you had a tooth decay and the dentist only did its job to help you keep on biting because you probably had some pain. I just assume because usually a root canal is done to get you out of pain.
Yeah.
And then what we do is we just basically take out the nerve, the blood supply, the lymph supply, and then fill this root canal with some sort of material, let's say a plastic. It's not correct, but let's say just plastic. Why? To keep this tooth for the sole purpose of biting, which is fine. It works, no problem. However, if you look at this root canal now from let's do a electron microscope, so very big microscope, you see per root, it has very tiny dentin tubules. That's kind of like a tubular system, and you have about 30 to 75,000 per square millimeters. And that is the perfect cave for anaerobic bacteria. So you can imagine there's tunnels and there are mice in there, and then there's the cat outside, which is your immune system. So you have chronic infection in that tooth now because there's no more immune system.
How does it get into it? Let's start with that.
Yeah, initially because you had a tooth decay. Yeah, tooth decay is like just a hole in your tooth.
Yeah.
Usually because
but they plug it with something, no?
Exactly, but because of that, the bacteria in that hole went deep down in your tooth.
Okay.
So they could have gotten into your pulp. The pulp is the inside of a tooth. And then you had obviously an inflammation and massive pain. So the dentist took it out. And they actually, endodontologists are the dentists that perform root canal treatments. They're actually very, very skilled. So they sometimes even use microscopes to really get these tubules clean and disinfected with ozone. And probably for a couple of weeks or maybe month, it's quite sterile. However, this tooth is in your socket and it hangs in your body, in your gum, and you have a huge microbiome in your mouth. There are anaerobic bacteria, there are aerobic bacteria, there are parasites, fungi, viruses, they all live with you. So now, because there's no more immune system in that tooth, bacteria can also go through the gum and the periodontium into the tooth from the outside, or even could have been gone into the tooth by doing the root canal. You understand? Okay. So it's both ways. So it's just a matter of time until that tooth gets reinfected. And it's not an acute infection. Otherwise, you would have pain. It's more like a chronic silent infection and silent inflammation that your body then causes because we have an immune system to attack invaders, right? That's what the immune system does. So if you would now do, and I'm just assuming, I haven't seen your cone beam yet. If you do a 3-dimensional X-ray of your root canal treated teeth, there's probably signs of chronic inflammation at the root of the teeth, which is the apex, an apical osteolytic
Do you
process.
find most people has them?
Yes.
Because you see many people. You see healthy people and unhealthy people, obviously.
I see both. I have to be fair. I'm very much in a bubble. People seek me out for that advice. So I'm very much like an outside extremist. However, yes, I see it with in my patients, it's 100%. And they come for this treatment because they already know, I either have to get more health back from here or I want to be more performance. Like, imagine you personally, you're already healthy, but if we can give you an hour more sleep, more solid sleep, how much does this investment help you for your longevity? It's insane, right? Yeah. And this is, of course, something you cannot really prove in advance. But the way I want to teach it is understand cytokines, understand chronic inflammation, that this is a sort of stress for your body. And it costs your body certain nutrients, costs your body energy. So if you take out a stressor, that your body suddenly doesn't have to compensate it anymore and has more energy to do other things, such as better sleep, better detoxification, better regenerative. You understand what I mean?
I do, but I hope he wouldn't mind because, Gary Brecka's example, because he shared it, it was very impressive in a way that, I guess he called a dentist that was trained by you because he wanted to upgrade his health or his mouth. And then the guy asked, where's your root canal? Yes. And he says, at some location, and he started counting, do you have a shoulder pain? Do you have a lung pain? So can you...
So every single tooth, when I show you a graph, every single tooth is directly connected to it's called a meridian, and in classical conventional medicine, this is again already woo-woo, which is lame, because it's connection of your autonomic nervous system to specific teeth. So for example, this tooth, like your front tooth, if that would be a root canal, is directly connected to your kidney and bladder meridian system, which goes straight through. It's connected to your eyesight. It's connected to your neck. So some people just have chronic neck pain because of it. And then they have a frozen shoulder, or they have hormonal imbalances, or cannot see straight.
How much down the road that these symptoms start?
This is the difficult part because obviously it's multifactorial. It's not just a root canal, but the root canal can become one big of a trigger over time. So for some people that are very sensitive, it starts straight away. They always felt a little nagging right after having a root canal. For some, they compensated for 20, 30 years, and then they maybe have some sort of a trauma, psychological trauma, or something in their body that shifts, and then they realize it only. Some people are even not fine-tuned at all and don't care at all. They can smoke 90 cigarettes, have 10 root canals, and sleep just fine. So everyone is quite highly individual, but I feel like everyone that we're talking to is very much on their journey to optimal health and therefore looking for these different things. So yes, it can start straight away or be subtle, But I can tell you every single patient, that's the fulfilling part. Every single patient has a story like Gary Brecker. And I love that. Yeah, Gary's doctor, Dr. Jigar Gandhi, is one of my certified real biodentists. And yeah, he got inspired through my work and followed me for a long time. And now he's completely certified. And this is also, it's such a small world. And I love that I can teach and bring this information to many, many more because, yeah, we have to change our profession. It's not, these days that, like we're living in an unhealthy world with tons of stressors. And we kind of like have to navigate it. So what we do for our patients is just, because there's so much information, they don't see the forest for the trees anymore. We give them the blueprint or like a direct line. And there's always oral health is a big part of it. In my opinion, the missing link to overall health optimization because no one looks there yet. So that's the idea of changing this. We still need dental work. We still need dental repair. However, we should do it with materials that do not interfere with the body. Because maybe in the 90s, it was fine to have a gold crown and a titanium implant. But then these days we have 3G, 4G, 5G, EMF everywhere. Every single metal in your body becomes a little tiny antenna.
Yeah.
So it's just a different world. So the question is just how can I get your body to the way it was when it came out of your mom? So you definitely had no root canal and no metals in your mouth because that's the most unnatural part in your body or your wisdom teeth weren't pulled. So just helping your body get back to his original state because dental repair is still the biggest trigger. It's something you cannot hack away, right? You have to see me or someone I've trained. So therefore it becomes my whole mission or it's now a complete movement that that we want to change this. And therefore we need as many dentists that are open-minded and focused on healing overall the patients as possible because it's basically, like you said, 90% have their wisdom teeth removed and have chronic health issues and don't even know about it. Tons of patients out there have root canals and no one ever told them that this might be an issue why they cannot get pregnant or that's why they have their acne or that's why they cannot sleep at night or that's why they have their SIBO. You understand? So it's just a big puzzle piece that no one talks about. And this is why I'm very happy that you talk about it.
You should talk about it because it's really...
I do.
I mean, I know you do, but so what are the symptoms that if somebody's root canal is inflamed, let's say? It can be all these things that can be from brain to the bowel system, like can affect depending on where it is.
So if you have a root canal treated tooth, initially you had massive pain. Then you got out of pain and it became a chronic issue. Main problem with chronic stress is it's usually pain-free. So you don't even know that this tooth here might cause your frozen shoulder. So whatever symptom you come up with, or let's say whatever chronic health issues you have, sleeping issues, anxiety, mental health problems, even cancer, neurological disease, you name it, SIBO, acne, skin eczema, gut health issues, joint issues, even inflammation in your brain, there could be a strong link to a stressor that is lurking in your mouth. That's the only thing I'm saying. The way how it does it is by raising cytokines, inflammation, as well as toxins, and puts a lot of stress and toxic burden on your body. But no one talks about it. No one looks that way because the regular dentist asks you, can you bite on it? And yourself, yeah, you can bite on it. You have no pain and it looks good, right? Why would you look into your mouth?
So what do you do different?
Yeah, so what we do is obviously, I want to see your panoramic, like your two-dimensional x-ray and look for these so-called triggers. We will remove, so in a nutshell, when it comes to the technical side of things, we take out all the metals safely without intoxicating you. We take out, I would say, probably most of the root canals, if not all, because patients seek for that, and place immediate ceramic implants to not collapse your bone, to give you teeth straight away, basically. And we would also always address removed teeth, or especially wisdom teeth, for these so-called cavitations, which are another chronic silent inflammation in your jawbone. No one talks about, especially not dentists, because this topic is not yet trained in university. So you see, there's even something no one knows about. So what we do is, the focus is, how can I help Esra to reach optimal health? What is still an issue?
So I have a question though. Listen, I know many people actually who had to have implants. Unlike how you're describing, they were waiting like for months without the screw to be placed. You're saying it has to be right then and there in order for the bone not to lose the structure or the space.
Okay, great question. I established that real quick. So first of all, if you have lost a tooth, the next step is called a dental implant.
Mm-hmm.
Yeah, and a dental implant in 99% of all cases worldwide is going to be a metal titanium implant. The usual route is, okay, you lost a tooth. The dentist will tell you to wait for 3 months to let that bone heal. Then we do a cone beam, maybe do a bone graft, and then maybe do the implant. Can take up to a year, 1.5 years until you have your tooth. So, because we are a little bit more, let's say, interested in how to optimize things, the question was always, how can we have our patients heal as fast as possible? So what we know is now we know it's scientific. So when I wrote this book, or when it came out 5 years ago, more than 5 years ago, 50% of what I was saying was still not medically proven or wasn't yet a guideline. Now everything I'm saying is a guideline, medical guideline completely. So we now know if you take out a tooth, the bone part where it was in there, like the hole, it's called a socket. So we want to preserve the socket, because if we take out a tooth and we do nothing, what happens is this bone collapses. That's called alveolar atrophy. It's kind of like atrophy of your biceps. If you don't move it, if you don't use it, you lose it. Same happens there. So it will collapse. So what we do is, first of all, we don't do a titanium implant. We do no metals. We use a ceramic implant made out of zirconia. Why? Because it's a complete biomaterial, it's neutral to the body, and it is white. Every single patient would choose a white one if they have the option black or white, right?
Don't they say it breaks?
Exactly. So one of the biggest critics was, this guy is taking out root canals. That's crazy in itself, taking out a root canal for dentists. Second, he's placing an immediate implant. That's crazy. He's doing a ceramic implant. That's even crazier because they break. And he will hurt all his patients. So now, because we've done that so much times, so I've placed more than 6,000 implants now, ceramic, in their way, we have a ton of clinical data. And now the medical world, the medical guideline established ceramic implants are fine. And they're also establishing now that ceramic implants placed immediately actually help the anatomy, the bone, and the tissue stay alive. So imagine you had this tooth and it is broken and you need to take it out. This one. Do you want to go with a gap for 3 to 6 months and have like a little tiny thing that falls out all the time? Or would you love for me to take it out very gently without hurting that gum, without hurting your bone, disinfecting it with ozone, using your PRP and stem cells and everything that we need in there, and then place an immediate ceramic implant which acts as a tent pole to stabilize the bone and put a temporary even on it. So you come out of the surgery the way you came in. And then we just wait 3 months until your bone stabilizes it. It's called osseointegration. And then we give you the real crown. That is a very charming way to do it. And it's only like 3 appointments within 6 months versus in 6 months, you haven't even yet placed a titanium implant. So even for dentists, that is a new field. And luckily, because ceramic implants are finally accepted, more and more dentists will come through ceramic implants, where I'm a specialist in. So that's a good thing. It doesn't mean it's biological. Biological dentistry comes next. So ceramic implant is only a tool we need in the Biodentistry 3.0 concept to help a patient on his overall health journey, because we don't want to place a metal. We want to have let's say, a neutral solution. The ideal solution, obviously, is your healthy tooth. Never lose your healthy tooth. But if you had a root canal or an inflammation and your tooth is gone, I get it, we need to repair. So you understand the ceramic implant and putting it immediately, it's like the most charming and the best strategy to never have any pain, actually. It's pain-free. Taking out a tooth, if you know how to, it's not yanking a tooth. It's just very, very gentle movements. It's kind of like stretching it out with the goal of not even doing a cut. And then just placing something. You come in, you have it done, and you come back 4 months later. However, that being said, can I add something?
Sure.
That being said, these interventions, an immediate implant, being it ceramic or titanium, in dental world, dental surgery world, is still a high-risk procedure. That's just normal. However, because we know that's high risk and we want to have that successful as much as possible, this is where all the other levels come in. the 3.0, the integrative medicine, the nutrition side of things, the supplements. And then on site, we have kind of like an oasis of health. We have a complete, let's say, a biohacking center. We run a lot of IVs. We have hyperbaric. We have red light, sauna. We have everything on site to be able to do these high-risk procedures, kind of like risk-free. But it starts in advance. We're preparing our patients 4 weeks prior to surgery with the right nutrition, depending on how good they are in shape. You probably already are in shape to get a surgery tomorrow, but most patients are not. And then we follow up for at least 3 to 4 months until we see them again, so they know exactly what to do in order to heal bone systemically, your tissue, and have as little swelling as humanly possible, and if possible, even no pain.
You're the third person in a row. A few weeks ago, I did an interview with Cameron Chestnut, a facial plastic surgeon, that he's exactly doing how you're doing the dentistry. He's doing the plastic surgery like that. The before prep and then the after hyperbaric and etc. And also I did another interview with Robert Whitfield from Austin. He's a breast explant guy. He's doing exactly the same. So the world is turning into a, hey, let's make you healthy. It's not just like, let's fix like one part of your body. Let's overall give you the healthy self.
Yes. Cool that you mentioned Cameron. I don't know him in person yet, but we chatted a lot on Instagram. Because it felt like, we're kind of like the same breed because we practice what we preach. And this is also part of the teaching for the dentist. I call the Biodentistry 3.0 is becoming a real biodentist, stands for being real, meaning we also have to practice what we preach. So I do the same things for me personally too that I do for my patients. And therefore, I don't even call them patients. I call them guests on their journey to optimal health and just map out their way. And obviously, if we have solutions to mitigate stress from a surgery and help them heal faster, it would be rude not to do it. That's actually how Chris Gethin would say it. I know you know Chris too.
Yeah.
Have you had him on the show?
No, not yet.
Not yet.
He was doing his travels. So tell me, what's that thing about the wisdom teeth? Because, I try to remember why they pulled it. I have no idea. And they couldn't even pull it out because, no numbing was helping. And they did literally a surgery to take it out. I don't even remember why. I was maybe, how old I was? I was maybe 25 or so on. I have no idea. I don't remember at all why that happened.
How can I explain it as easy as possible? So in the Western world, we have a spacing issue. That means we basically grow too narrow and a little bit more longitudinal than squared.
Why?
So 10,000 years ago, we had 2 sets of wisdom teeth even. So we had space for 2 more teeth. That it has a lot to do with our environment, the change in our food, eating more soft foods, not chewing anymore, but also having lots of nutritional deficiencies. It also has to do with not breastfeeding. There's many factors leading into this, but mainly is a lack of nutrients in the growing phase.
I need to make a joke because, when you said there was 2 sets of wisdom teeth. So I have a pug and they're not very famous with healthy teeth. They're not having a perfect teeth. And they keep pulling my poor dog's tooth out. And I was like, he's going to soon be toothless. And the woman turned, the dogs has like 48 or 47 sets of tooth in their mouth. I said, okay, you can keep pulling it out.
That's funny.
Yeah.
Yeah, actually we had that too, a little bit more, but however, we don't have the space anymore. So therefore, the strategy, and actually that's an epigenetic strategy, is that young kids mostly, like teenagers, get their wisdom teeth pulled in order to get braces, just because they assume there wouldn't be enough space. And it's probably correct. There is not enough space. You can see that early on. So they pull out teeth on average. That's why I'm always talking about wisdom teeth removal. And I ask the question, have you removed your wisdom teeth? So if you had your wisdom teeth removed, this is what you have to know. Because the way we do it is, tomorrow is your appointment. We're going to take out these wisdom teeth. Usually you're not prepared. You're a teenager. It's a rough surgery, very fast, and you end up having huge swollen cheeks and you cannot eat. The only good thing is you have a school leave for a week because that's already planned in because of such a rough thing. When we only explain to our patients, you're going to need to apply cold, you're going to need painkillers, and we use a local anesthesia. But there's no preparation of these patients when it comes to, are they even able to sustain a surgery? Are they in a right set of nutrients? Are they prepared systemically for bone healing? Usually they're not. So the problem is, over time, this area doesn't really grow bone. And what happens is it develops these so-called cavitations. Cavitations is just a layman's term for something we call FDOJ, fatty degenerative osteonecrotic jawbone. Basically mushy bone in your jaw that you can only find on a three-dimensional X-ray. So you can only find them on a three-dimensional X-ray. I just lately realized that probably less than 10% of all dentists worldwide have a three-dimensional X-ray called cone beam. And then 99.8% of all dentists don't even know about cavitation. So even if you had a cone beam done, you still need someone who knows about it and is trained to find it. Because then it is another chronic silent inflammation in your jawbone, such as a root canal, that could potentially cause a lot of chronic health stress in your body, leading to a lot of different symptoms. So from that tooth meridian chart again, the wisdom tooth area is connected to your small intestine. So think SIBO, intestinal issues, acne, skin eczema, various food intolerances, thyroid issues, but also the heart meridian, heart palpitations, issues, and anxiety.
So out of what? Out of because they pulled and you couldn't heal properly?
Yeah, exactly. So exactly. The problem is you take out a tooth in an unprepared patient. Because imagine, when you're 25, I don't know you, but when I was 25...
Believe me, I was in my highest party time.
Yeah, me too.
I mean, then therefore I needed to get into recovery. So I was like listening to you, I'm like, oh my God, it was the worst time of my health.
Exactly. So when I was 14, 15, 25, when they took out my wisdom teeth, same. Completely partying, smoking cigarettes, not eating good food. So I was not prepared for a surgery and therefore it didn't heal. So I had cavitations myself too, which we only found out about probably 15, 17 years later because I had systemic health issues. I didn't even expect this to be a cause of it, but it was. So it doesn't heal because you're not prepared and the surgery is quite rough. So instead of building solid bone there, we end up having caves. That's why they call it cavitations. And the caves are, again, the perfect spot for anaerobic bacteria, parasites, fungi, viruses. They lurk or live in there, and the immune system cannot really get there. So in there's also a specific chemokine called rantes, which is kind of like you know what cytokines are? So it's a specific chemokine that can trigger lots of health issues, and they're quite high in these areas. So it is, again, a chronic silent inflammation in your body. And we know that chronic inflammation is stress, and stress is killer number one. So here is another issue that you don't even know about here. And this is not just your arm. When you have an inflammation on your arm, no one cares because it's just your arm. But this is directly your brain. It's an extension of your brain. It's like your eye. And on this nerve, these parasites, fungi, viruses, or even toxins, they find mercury in there, they find glyphosates in there, go directly back to your brain. That's called retrograde axonal transport and can influence the whole body. Could just be that you tense all the time because these muscles get activated. Or, like I said, have shoulder issues, joint issues, knee pain. And I think it should be informed consent and worth noting that this is even existing, because the problem is no one knows that it's existing and therefore no one looks there, and it might be the issue why you cannot sleep or why someone else cannot get pregnant right now, because it's just another stressor in your body, but a very big one. So it's in your nervous system.
So you're very focused on three things then: the root canal, wisdom teeth removed, and the fillings, metal fillings, obviously.
Yeah, from a technical side of things, just the ground level when it comes to the skills that we still have, it's excellence in skills, no metals, no root canals, and no cavitation. So no jawbone inflammation. That is our initial goal. However, then if that is all healed, in order to heal that, we have built on site everything we need. So patients fly in usually for a week, a health optimization week, stay on site, have all their treatments. But then the next 3 to 4, maybe 6 months, we need bone building phase. So your body is osseointegrating these ceramic implants, so building bone around it, but also these cavitations that we took care of are now building solid bone. And then when you come back for your final crown work, which is the teeth you see, the aesthetic part, the functional part, then we do that as perfect as humanly possible, like even from an aesthetic point of view, functional point of view, top notch. And then the goal is to never see you again in your life as a dental patient. That's the goal. You can still come in for health optimization, everything you need, but not the conventional dental way that, we see each other in 6 months and you have another tooth decay and we do another crown and then the dental career. We do it overall once and for all. And it's just one part of your health optimization journey.
So what do you do to the cavitation? Because it's covered with flesh. Mm-hmm. You cut into the flesh?
Yeah, exactly. So it is a very, very minimal invasive procedure. So you're correct. It's behind your teeth where your wisdom teeth should be out. They're not. So there's gum. So basically we open up that gum very gently without scarring. And then we open up that little bit of bone with it's called piezo surgery. It's very minimal invasive, kind of like ultrasound surgery. It's not correct, but it's piezo. And then we clean out the whole jawbone of that fatty degenerative tissue because we have to take that old stuff out. Then we clean it with ozone. So I can produce ozone directly into your jawbone from medical grade oxygen. Then we draw blood and spin it to make membranes, kind of like PRP, but it's called PRF in the mouth. Put those in there to speak to that. And then close it up and let it heal. Basically, we make that chronic inflammation acute again so that your body is now able to heal. But because we're not stupid and we don't want to have the same result than 20 years ago, we prepared you in advance. So we know you come in high-level nutrient status. And to compensate for the extra stress of surgery during the time you're here, we use the Optimal Health Lounge with IVs, hyperbaric, laser in your vein, even hypoxia training, whatever you want to wish for. But that is only to cover this phase. So the preparation is yourself doing your right nutrition and supplementation. And the same thing will go on for the next 3 to 4 months. We do an in-body scan, which is measuring your body composition. So because it's about overall health and we're changing your complete lifestyle and nutrition, by doing this work, that is the entrance to your gut system. We also rebalance and rebuild your complete gut system, and you probably end up losing 10 kilograms of body fat in the same period if you do all the protocols we design, because it's all about overall health optimization starting from the mouth. So imagine tons of inflammation going. It's probably the biggest detoxification you will ever do, because that is material stored in your body. If you would see what Sean had in his mouth, like just on a plate in front of us, he has done a lot of videos about it. Yeah. He even showed the insides, metals, all the things. This is stuff you cannot detox yourself. We take it out. That's the biggest detox. Just remove the source.
So what is the reason that, someone skilled needs to remove the metals? Is it better to keep them if you don't have anyone to be able to know how to remove them?
In my opinion, yes. So metals have a couple of challenges. Metals can be very toxic. And this is mainly the black fillings we're talking about. They're called amalgam fillings, and they contain 50% of mercury. And mercury is the most toxic non-radioactive element known to men. So it's insane for me why that's even in your body. Anyways, it is in your body, and it leaches out of that filling every single day for 10 years, 15 years, 20, 30 years, chronically intoxicating you with a little bit of mercury vapor. However, it's only a tiny little bit. If we now remove that filling just by drilling it out and don't take care about the safety measurements, we're drilling out way more mercury vapor, which could actually potentially make you sicker. So therefore, you should find someone who is skilled to remove that metal fillings safely. And this is a couple of different measurements. I have checklists on my Instagram you can check out. So at least a rubber dam. We have a special suction that suck up all the vapor. And we do IVs right next to it. We put chlorella in there. If possible, we break out the filling, don't even drill it. So there's lots of protocols. And all the ones I've certified in Bio Dentistry 3.0 obviously know exactly how to remove metal safely because it's important. It's also important, obviously, for the dentist and the staff to not get intoxicated all day long from that stuff. They're called real biodentists, and you find them. If you send me a comment reel on Instagram, you get the directory where they're linked. But there's also the IAOMT in America. They train dentists to be SMART certified, SMART. That stands for Safe Mercury Amalgam Removal Techniques. They know this too. So you have to find someone skilled. So don't run to your conventional dentist and just take out the metals unsafely. Relax. This is just new information. I'm not here to scare you or fearmonger or anything. Just there's more room for health optimization and improvements, but we need strategy for that.
Dome, you remember our conversation at A4M? It was about like toothbrushing, whatever. You go like, if I eat the right food, I don't need to brush my teeth.
Did I say that? Yeah, that's correct.
I know. Can you explain that?
if we would live according to nature, we would have teeth hard as stone and more like today, very wide jawbone muscles and jaws because we ate more hard foods. Because there was no processed foods. We just would eat real food. And if you eat real food, the food itself cleans your teeth. There's not lots of processed stuff that like lingers around your teeth and gets that biofilm. So I know this is probably not possible in this world anymore because most patients eat most people eat some sort of processed foods or let's say highly processed foods. In the advent of, let's say, when we designed sugar and flour and refined oils and all these things, made everything more convenient. However, it made us a little bit softer. And therefore, if we eat a lot of processed foods, oftentimes they end up on your teeth like that fur, that so-called biofilm. And this is the initial start to tooth decay, combined obviously with a lack of other nutrients. So in an ideal world, and you eat only the right stuff, it is possible to have teeth hard as stone because that's how they're designed. And then you would not need to clean them or brush them. It's done by itself.
So let's then take from the birth. What do you suggest parents to start doing from like day one of a baby in life?
So ideally, you start even before pregnancy to build the mom. The mom should prepare as much as possible to be in a superhuman status, so fully filled up with every single depot of nutrients, if possible. Right nutrition, right supplements. Why? Because when you get pregnant, building the baby requires a ton of nutrients and a ton of building capacity. And it's a big stress. It's a huge demand on your body. Let's say your body will prioritize the little baby, not yourself. So in order to keep yourself sane and healthy, support yourself with more nutrients. And then your baby and yourself come out healthier. So that's the number one. And also obviously remove all the toxins before you get pregnant, if possible, because they usually get transferred through the placenta or through the womb, through the breast milk even. And then if the baby is here, ideally you would breastfeed, because breastfeeding transfers your complete immune system. It is also the first orthodontic treatment, meaning it helps the jaw grow, the lower jaw to grow forward, and also the upper jaw to get wider because you have to breathe through your nose. So it's training nose breathing. So it's immune system, it's orthodontic treatment, it's bonding. It's just beautiful and amazing if it's possible.
Is there a time for that physical structure to be built, like 6 months, 3 months, 12 months? Do you have any suggestion?
So ideally, if possible, you breastfeed for at least 18 months. Longer is also fine. There's many things to consider. So, for example, if you're super healthy, you can do this, and you should breastfeed on demand, not by watching the clock and say, okay, now is lunchtime, now is bedtime. So the baby needs to be breastfed on their wish, so to speak. That is a very important one also for the hormones of the woman. And obviously, don't stress it. Yeah? I know there are many women out there that are not able to breastfeed, so don't freak out. But if possible, I just want to change the narrative here, because in Germany, at least, it was kind of like not en vogue to breastfeed. Instead of like, I mean, this is how we're designed. If possible, do it, because it's also so much easier instead of like carrying like bottles and stuff. Because if your baby sucks on a breast, on the breast, you need a lot of strength to pull the nipple forward, and that creates forward movement for the jawbone.
And you don't need to extract the wisdom teeth at that point because, you have enough space, huh?
I would love to say that this is enough. I think it's not, because probably it jumps a few generations. I think, so if my kids get breastfed for 18, 20 months, which they all did, my wife is a superwoman when it comes to breastfeeding, it worked. I still think, because I personally had orthodontic treatment twice. My wife had it too. So we were already degenerated.
Oh.
So I have, for example, you can see it, my lower jaw is quite strong. But my mid-face didn't really grow because I had mouth breathing very early on, because I was allergic to milk. No one told me. So my mid-face didn't really grow. This gene will maybe be incorporated into my kids too. So I have to pay a close attention. But I think if we install the right lifestyle, the epigenetics, the breastfeeding, and then afterwards the right nutrients, obviously. It's not just the breastfeeding, it's also what gets fed afterwards, the next 15 years to build that huge body, because it's growing till you're like 18. Probably if my sons get their children they have a chance to have perfect gums and jaws again. Maybe even my kids already do. Let's see.
So, there's a huge debate in America about fluoride. Actually, Andrew Huberman spoke about it in his podcast. Like, the West Coast was suing their government and their city because there were fluoride in the water. And then the East Coast were like, you didn't put enough fluoride. Our kids' teeth are not strong enough. So what do you think? Do kids need fluoride in their toothpaste or somehow to make their teeth stronger?
No. So biological dentists is always team no fluoride. So fluoride, yes, it does make your teeth a little bit harder, but also more brittle. Because in nature, the fluoride we're using in toothpaste is sodium fluoride. That's a complete chemical. It is actually highly toxic and is not calcium fluoride that you find in a mineral. Our teeth are more, it's hydroxyapatite that's in your teeth, but our teeth are just a crystal structure. So I would always think about how to support my teeth and my enamel outside teeth with the right nutrients from within. And fluoride from the water has been shown, not even fluoridation or all the stuff that's coming out right now about fluoride is it lowers your IQ. It is a strong toxin. It affects your thyroid. There's much things that I personally rather avoid. If I give you a potential solution to make it the same way but naturally and healthier. And luckily, you should have an active ingredient in the toothpaste. So the fluoride is considered an active ingredient. However, if you don't go with fluoride, you should at least find one that has hydroxyapatite in it, because that is the same idea, but without any risk or side effect. So established it, because I've been on a quest to find the right toothpaste in America, like all over the world if I go to a supermarket. And usually the ones without fluoride are lacking the active ingredients and are just like having essential oils and stuff, but that doesn't really help. If a patient or someone out there listening is already on a super real food diet, has all the micronutrients in check, such as vitamin D3, vitamin K2, magnesium, boron, zinc, methylated B vitamins, yes, maybe that toothpaste is enough. However, you know it yourself, 80% that are listening are not that way advanced, so they should find something with hydroxyapatite in it that has an active ingredient. I have my own supplement company in Europe and also in America. And in America, just started yet as Supreme Oral Health, if I'm allowed to say. And in Europe, Subs Nutrition is there for over a decade. And we just launched the first toothpaste, more than a toothpaste. It's called, it was sold out in 4 weeks. So I'm sorry about that. But this was my design. And I tried to design a supplement that you can eat, because basically that's the goal, right? Put something in your mouth, you want to eat it, because it will be, not if you don't even swallow it, the fluoride or all the other toxins in a chemical toothpaste, at least they go through your lymph system or like what will be absorbed by your lymphatic tissue. So
you created a toothpaste based on a supplement, what the
thought process
would need, correct?
Exactly. So
and you can eat it.
The idea is, okay, if we want to have perfect oral health, it's super simple. We still need to brush, right? So I looked at all the toothpastes out there existing, and as you know, they're all copy-paste, super toxic chemicals, including fluoride and other things. I personally don't want to put them in my mouth and nuke my oral microbiome. I want to have something that supports my microbiome as well as my teeth with the right nutrients and obviously can clean. So I've designed it on a coconut base. There's hydroxyapatite in it. There's a specific probiotic in it. There is lactoferrin for your gums in it. And it cleans good with silica and is not abrasive. And you can even swallow, and you could swallow and eat it because it's for your kids and yourself. So that was my idea. Secondly, after brushing, in my opinion, you should straight away go to shield your teeth. Shielding means, how can we protect our teeth from the inside? So that's
from inside, okay.
Yeah, of course. And that's why I designed Tooth Shield as a one-stop shop supplement that contains all the critical nutrients that are there for tooth, hard as stone, and bones. Teeth and bones are the same, and gum and good solid gums. So it's basically vitamin D3, vitamin K2, magnesium, boron, zinc, methylated B vitamins, biotin, and much more in a specific formula I have in Europe for decades called Bone and Teeth in Europe, and in America, Tooth Shield. That is the second thing you should do. Support your body with the right nutrients, kind of like watering a plant. You have to give your teeth these things. Obviously, in nature, if we only need the right perfect food and we're outside in the sun and in the sea all the time, we might not need it. But let's face it, we're not. We're lacking a lot of vitamin D3 and crucial other things. And therefore, I think that's a solid strategy to brush and then shield, clean shield, and then the other things.
So what should be the oral health, daily
Strategy?
oral health, strategy for someone?
Yeah, I still think that we should brush our teeth. But like I just said, go for something that is without toxins. At least find something fluoride-free, toxin-free. There are a couple of companies in America, I think. If you could look into a couple of comments under my videos, just find something with hydroxyapatite, xylitol, coconut oil, but that skips all the chemicals. So that's established. Second, just when it comes to oral cleaning, I would use coconut oil pulling instead of these chemical mouthwashes. Don't do all the blue and red and brown stuff that you can drink and spit out. And they are heavily marketed to clean your mouth and give you good breath. The only thing they do is they kill your oral microbiome. They're full of alcohol and they're very highly acidic and actually make your teeth go bad and your oral microbiome. So I wouldn't do it.
Didn't you say in something that, one of the ingredient is like the floor wash?
No. For example, the one with an L, like the general one.
Yeah.
Look that up on Wikipedia. This is initially the design is for cleaning a floor. And you can also clean your toilet with it. But I wouldn't clean my mouth with it, yeah? But therefore, you can just use coconut oil pulling or oil pulling. You could even do oil pulling with extra virgin coconut oil. Shout out to Dr. Stephen Gundry. Yes, possible. Coconut oil has a specific lauric acid, which is antiviral, antibacterial. So that helps. And then we use a tongue scraper as number 3 strategy. Tongue scraping is, again, Ayurvedic strategy. You just use ideally, it's made out of copper. It's just a device that really scrapes your tongue. That's what it does. 10 seconds a day is fine. Why we do that? It helps against bad breath. It's like the ground of your tongue has a little bit deeper fissura. And in there are a little bit more bacteria, a little bit more food from overnight, a lot of toxins. So just by brushing that off or scraping it off, you help your microbiome. So that's the 3 things. But then, like I said, from within, you should think about shielding your body and giving your body the right nutrients to get teeth hard as stone. They're built from the tooth nerve, the pulp, as well as through the saliva. And this is all depending on your nutrient status. If you have a lack of vitamin D3 and K2, you're probably having less good bone and less good teeth, for example. And then you need lots of other cofactors that I just touched on. Zinc, magnesium, boron is a crucial one. And you don't want to have all the separate supplements. Therefore, I designed this formula a long time ago and iterated it all the time because it's part of my bone healing protocol for all the surgeries. And now it's finally there for everyone that is interested.
So I feel like, also with taking care of the mouth, the small
tooth decay,
tooth decay. Yeah. So you can kind of, if it's small, you can kind of heal it, I guess.
Exactly. So initial tooth decay is usually when it's still in your hard part of your tooth. It's in the enamel. So if it's still in the enamel, you can reverse that. But you don't want to drill it. A trained biodentist will never drill it. They will look into your overall health and see, oh, wow, first glance sign of nutritional depletion. We need these certain ingredients to help your body systemically build bone and teeth. Like I just said, vitamin D3, vitamin K2, magnesium, zinc, boron, methylated B vitamins, lots of other things, but in a nice structure. So like I said, Europe is subnutrition, bone and teeth, or America, the tooth shield. So it's a super simple, solid strategy. But again, everything, also the cleaning part, comes down to consistency. So if you do the coconut oil pulling once a week, it doesn't really matter. You have to do that every day or at least every other day. So make a habit out of it. Brush your teeth twice. And then flossing is something that you might need if you had previous dental work done. And I personally don't really need it. I do it from time to time if I had food stuck in between or if I feel like I need it. But I have no tooth decay. I have no filling, no crown, no root canal, no nothing. So for me, it's not too much needed. But yes, for most patients out there that had dental repair done, probably flossing is a good idea. But find a floss that is without BPA, like a clean one.
Oh, gosh. It's so difficult, all these.
I know, it's so difficult.
So where is your institution in Germany? Because, there's a lot of Turkish expats in Germany, and they really watch my program.
I know there are a lot of Turkish people around my area too. Even in my clinic, I have a lot of Turkish people. So
oh, really?
I think in southern Germany, where I'm at, there are many, many.
Where are you?
Very close to Stuttgart. Stuttgart is in the south, and then it's about 20 minutes with the car to Tübingen is the city. The clinic is called DNA, the Center for Biological Dentistry, or DNA Health and Aesthetics. But I think I'll give you all the links for the show notes, or Elke will do that for sure. Then it's easier. So it's very close to Stuttgart Airport. And it is including the Optimal Health Lounge that I was talking about. It's kind of like a center for health optimization. We just include, obviously, starting from the mouth because that's the specialty and missing. But we're building more and more things towards optimal health to help everyone coming in as a guest on their journey to optimal health, and even work with a huge network of practitioners worldwide for other things that are needed on their journey.
If I need to sum it up, world is going toward a holistic healing. And if you go to a plastic surgeon, they approach the same way. He says, like, your vitamin D level is very important because it's going to help you not to get infected after the surgery.
Exactly.
You're saying the same thing. Many people are trying to help their clients to heal as fast as possible instead of suffering. And while doing all of these, they're trying to help them to fix most part of their body, not just their teeth, their breasts, their face, but saying that, hey, this is your health. This is just extension. But in order to be healthy and continue to your journey healthy, you need to pay attention to all of these, basically. So you are in a functional medicine doctor, which is focusing to teeth, basically.
We focus on the overall health, but starting with the mouth, with the teeth, because obviously that's some part that unfortunately most functional medicine practitioners cannot solve, because for that you need a open-minded dentist that understands all this. That's why this is a new breed we have to train. Like I said at the beginning, therefore we need to change our profession from the technician to the physician, to a health expert overall, obviously still focusing on that mouth, but at the same time focusing holistically on overall health and helping patients overall. That's why nutrition is huge with us. All the other things are very big. And then there's other very nitty-gritty specialties that we don't do, but we maybe send someone out to Wells, like where's the best in that field. But yeah. I feel that every single, let's say, health coach, doctor, medical doctor, ND, MD, whatever D, should know about oral health, and that this is a big part of the health optimization journey for every patient out there. It needs to be asked and it needs to be addressed quite soon. Obviously, every patient needs to be prepared, but this is something that functional medicine does quite well if the nutrition is on point. And biohacking and the space we're in, most patients are actually quite well prepared. So you probably could come in quite fast for your health optimization because you're already, I'm just assuming, you're in top health when it comes to nutrient status, your hormones and everything. So you can come in and then I can do a surgery, because that's the goal actually. We should be as optimized that we can go into a surgery every single day, because something can happen every day. I can break everything, or I break an arm. I want to be in a supreme healing mode to heal it. So it doesn't take 3 months to heal, but only 4 to 6 weeks.
Thank you so much for your time. That was great. I'm really excited to air this thing, and I want to come to see you. I need to come to see you.
Yeah, of course. That's what I'm here for. You need to come to see me, of course.
Thank you, Dom.
Thank you.